butterflyer, so it's the worst of all of the swim strokes. So if I'm here, and I would be on the side, but I'm going to make sure I grab a hold of it and do my glide, just like I would do if I were, did you feel that? You got a lot of motion. Mm-hmm. Just as I would do, so whoever's her partner, don't mobilize her too much. She's unstable probably. She needs some thoracic work. So that's how I would do that. So I would be here, right, and I would kind of stabilize like this, and I would try to just grab it and move it. If it moves, we're good to go. The other way that I like to do it, come sitting, and I don't remember ever learning this in school, swing around, is again, like we did before. I just move her. I'm feeling. Clunk, clunkety, clunk. So I'm feeling for all the motion. Is there a gapping happening? And if not, I want to treat that. My way that I like to treat it is not direct moves anymore because it can be a little bit painful to grab a hold here. I'll just do an easy muscle energy. Okay, so go to the barrier. When I feel it stop moving, she pulls in gently, hold, release. Hold, release. I can do any of the motions. Abduction, I gotcha. Push down gently, hold, release. Hold, release. It's so subtle, but that's all you need. So you can find where's the restriction. If she comes across here, I feel gapping. If I didn't feel gapping, push out into me, release. Push out into me, release. So Amy was with me yesterday in the clinic, and we did this, right? You saw me, there was that older lady with the elbow, right? Yeah. So I'm treating this lady, this has always happened. She comes with low back pain. She's got lateral epicondylitis over here. She hasn't played tennis or golf. Like, what the heck does she have lateral epicondylitis? So she's like, it's killing me. Can you do something with that today? So I'm like, okay, I'm straying from the low back. I'm like, sure, it's a rib cage connection, whatever. So I checked her shoulder. She is post-rotator cuff years ago, okay, on the side. So all of a sudden now we have a right, she's got right SI issues. So now we have a posterior sling connection, right? So I can document this and bill for it, right? So I'm working up here at her shoulder, and I feel she doesn't want to move into flexion or extension at her glenohumeral joint. So I talked with her about her rehab history. Nobody ever put their hands on her. They didn't even do a scapular lift, nothing. Nobody touched the scapula, nothing. So she was very restricted. Full function, but she got there because she cheated her way through it somehow, right? So she's probably a little, I don't know where they get their motion from, but it's restricted somewhere. So it's like all these people that we force them up here. It's like you don't really need to force them if you've given them the right pathway to get there. And so she was restricted. I felt like there was this barrier. It was sluggish. I couldn't get her forward. It's very subtle though, so you have to be aware of it. I couldn't take her out. She had no movement in her AC joint, so I just played around with her and muscle energy, and I floated her up here, and I floated her back here. I had her pull forward and pull back. She pushed forward. We pulled back, things like that. We did the AC joint, and all I did was find her restriction. All of a sudden, like after about a few minutes, she was like back here, and she was up here, just from restoring this. So I didn't even do my traditional AP glides or PA glides or distraction. I simply treated out her SC joint and her AC joint, and I treated her glenohumeral joint via muscle energy, okay? And I creeped her up, and I creeped her back. So she pushes forward gently. I hold, resist, release. I'm feeling for movement. I'm guiding this glenohumeral joint. She pushes forward, release, pull back, release. You see that? How simple it can be? And all of a sudden, she was like, up here, she emailed me last night and she said my elbow's better. I'm canceling the doctor's appointment because I don't need a cortisone injection. Because it's not this that was really the main problem. This was just the victim. She had all this feeding her system. Does that make sense? So don't discount. They probably have stuff here. I had